Hello, I'm one of the environmental health specialists for Marion County Health and Human Services, and we're more commonly known as health inspectors. Marion County issues over 2,000 licenses annually, which includes the following type of facilities, things like restaurants, food trucks, food booths, pools and spas, hotels, RV parks, and organizational camps. We also perform inspections for various state facilities like hospitals, schools, and daycares. Being an environmental health specialist comes with various roles and responsibilities that can change on a daily basis. Really, no 2 days are the same in the world of an environmental health specialist, so we may be called upon to act in emergency roles, where there are issues with public drinking water because of a flood, or emergency inspections of a shelter due to wildfires or storms. The following are the main roles that an environmental health specialist may perform.
The primary role of an environmental health specialist is to perform unannounced routine inspections to get a snapshot of daily operations. This gives us a good idea of how well they are meeting the rules. Our goal is for a facility to achieve compliance with Oregon food sanitation rules. We will check for good hand hygiene, cleanliness, proper food preparation, temperature control, and pest control, to name a few. We leave the operators with a report documenting any violations we observe.
According to CDC estimates, 1 in 6 Americans get sick from a foodborne illness. More than half of all foodborne illness outbreaks in the U.S. are associated with restaurants. When called upon, we investigate foodborne illness complaints and other complaints that are associated with public health risk factors. Hi, this is Greg Desmond with Marion County Environmental Health. I'm calling in regards to an illness complaint that you submitted about one of our restaurants. Do you have some time to go over some illness questions with me? Okay. During this consultation, we asked the person who filed the complaint questions related to illness symptoms, food consumed in a 3-day period, and other potential factors that could have led to illness. This can include exposure to the following: recreational water, contact with other sick individuals or animals, attendance at mass gatherings like fairs or festivals, and more.
During inspections, we educate kitchen staff and management on how to improve their food safety practices. Being an educator of food safety practices during inspections can be an extremely valuable tool for building a trustworthy relationship between businesses and the health department. Without providing education, the path to safely operating a food service establishment can be extremely difficult for both parties.
When all else fails, enforcement may be a necessary tool. There are some situations where education alone is not enough to prevent a significant risk to public health. These situations may include safe, clean water not being available in the facility, pests like rats or roaches being found in food or equipment, sewage backing up in food preparation areas, or food being sold to the public without a license. In these instances, inspectors may have to issue an order of closure for a business until they can solve their issues and we allow them to reopen safely. To find out how your favorite restaurant scored on their last inspection, you can check out our website, which is displayed at the bottom of the screen. You can find our inspection reports and also other information about our program.